5 common foot pain mistakes seniors make and how to fix them. Foot pain can make every step a challenge for seniors. Are you tired of the discomfort holding you back? If you're over 65, you're not alone. Up to 87% of seniors experience foot pain, according to a Journal of Foot and Ankle Research study, often due to conditions like arthritis, neuropathy, or simply aging. But what if the way you're managing your foot health is actually making things worse? Many seniors unknowingly make mistakes that increase their pain, limit their mobility, and even raise their risk of serious complications like infections or falls. In this video, we'll uncover the 5 most common foot pain mistakes seniors make, and more importantly, show you how to fix them with simple, senior-friendly solutions. From wearing the wrong shoes to ignoring early warning signs, these mistakes might be the hidden reason your feet hurt more than they should. By addressing them, you can reduce swelling, ease discomfort, and get back to enjoying your daily activities, whether that's a morning walk, gardening, or playing with your grandkids. We'll also share a bonus tip at the end, a daily foot check routine to help you catch issues early and keep your feet healthy. Why does this matter? Foot pain doesn't just affect your feet, it impacts your overall quality of life, making it harder to stay active and independent as you age. A Silver Sneaker study found that seniors with chronic foot pain are 30% more likely to reduce their physical activity, which can lead to weight gain, weaker muscles, and even depression. But the good news is, you don't have to live with this pain. Small changes can make a big difference. What can you expect from this video? We'll break down each mistake, explain why it's harmful, and give you practical fixes you can start using today, like choosing the right shoes or knowing when to see a doctor. These tips are designed with seniors in mind, so they're safe, easy, and effective, even if you have limited mobility or conditions like diabetes. Ready to take the first step toward pain-free feet? Let's dive into mistake 1 and get you walking comfortably again. Let's start with mistake 1, wearing the wrong shoes, a common error that can significantly worsen foot pain for seniors. Many of you might be wearing shoes that are too tight, too narrow, or lack proper support, thinking they're fine because they've always worn them. But did you know that ill-fitting shoes can crowd your toes, increase pressure on your feet, and lead to painful conditions like bunions, hammer toes, or even plantar fasciitis? A Journal of Foot and Ankle Research study found that 72% of seniors wear shoes that don't fit properly, contributing to chronic foot pain and reduced mobility over time. Why does this happen? As we age, our feet change, arches flatten, feet widen, and we lose padding under our heels, making us more prone to discomfort if our shoes don't accommodate these changes. Tight shoes can also restrict blood flow, which is especially problematic for seniors with conditions like diabetes or neuropathy, as poor circulation can slow healing and increase infection risk. So, how can seniors fix this mistake and choose the right shoes to ease foot pain? First, look for shoes with a wide toe box to give your toes plenty of room to move, preventing crowding and reducing pressure on sensitive areas like bunions. Second, opt for low heels, less than 1 inch, to maintain stability and avoid straining your arches, which can help prevent plantar fasciitis flare-ups. Third, ensure your shoes have good arch support to cushion your feet and distribute your weight evenly, reducing stress on your heels and forefoot. What about seniors with specific foot conditions? Can the right shoes help? Absolutely. For those with arthritis, supportive shoes with cushioning can reduce joint pain by 15%, according to a Silver Sneakers study, making every step more comfortable. If you have neuropathy, look for shoes with soft, padded interiors to minimize irritation and protect your feet from injury, as numbness can make you unaware of cuts or blisters. How do you know if your shoes fit properly? Your toes should have wiggle room, about a thumb's width of space between your longest toe and the end of the shoe, and the shoe should feel snug but not tight around your heel and midfoot. When should you shop for new shoes? Shop in the late afternoon or evening as your feet swell throughout the day, ensuring you get the right size for when your feet are at their largest. What if you're on a budget? Can you still find good shoes? Yes, many affordable brands offer senior-friendly shoes with these features, and you can also use orthotic inserts to improve the support of your current shoes, as long as they're not too worn out. Why is fixing this mistake so important for seniors? Proper footwear doesn't just reduce foot pain, it also lowers your risk of falls by 20%, per a Silver Sneakers study, helping you stay active and independent. Ill-fitting shoes can throw off your balance, especially if they're too loose or lack traction, increasing the likelihood of tripping or slipping. By making this simple change, you'll not only feel better, but also move with more confidence, whether you're walking to the mailbox or enjoying a day out with family. Ready to take a step in the right direction? Let's move on to mistake 2 and keep your feet on the path to relief. Moving on to mistake 2, ignoring early foot pain symptoms, a habit that can lead to serious complications for seniors. It's easy to dismiss minor discomfort as a normal part of aging. Maybe you feel a slight ache after walking or notice occasional swelling, and you think it'll go away on its own. But did you know that ignoring these early warning signs can allow small issues to grow into bigger problems, like chronic conditions such as neuropathy, arthritis, or even infections? A Journal of Foot and Ankle Research study found that 65% of seniors delay seeking help for foot pain, often waiting until the pain becomes unbearable, which can significantly worsen their condition over time. Why is this so risky? Early foot pain can be a sign of underlying issues. For example, a burning sensation might indicate neuropathy, especially if you have diabetes, while stiffness could signal the onset of arthritis. If left unchecked, neuropathy can lead to numbness, making you unaware of injuries like cuts or blisters, which can then become infected, particularly for seniors with slower healing due to age or diabetes. Similarly, untreated arthritis can cause joint damage, making walking increasingly painful and limiting your mobility. So, how can seniors fix this mistake and address foot pain early to prevent these complications? The first step is to pay attention to your feet. Don't brush off persistent pain, swelling, or unusual sensations like tingling or burning, as these could be red flags for a deeper issue. Second, see a doctor or podiatrist as soon as you notice symptoms that last more than a few days, especially if you have conditions like diabetes, which can make foot problems more dangerous. Third, keep a foot pain journal to track your symptoms. Note when the pain occurs, how long it lasts, and what makes it better or worse, so you can provide your doctor with detailed information for a more accurate diagnosis. What should you expect when you see a doctor? They might recommend tests like an X-ray to check for arthritis or a nerve conduction study for neuropathy, and they may suggest treatments like orthotics, physical therapy, or medication to manage the underlying condition. Why is early action so important for seniors? Addressing foot pain early can reduce the progression of pain by 30%, according to a Journal of Foot and Ankle Research study, helping you avoid long-term damage and maintain your quality of life. For example, catching neuropathy early can prevent complications like foot ulcers, which can lead to infections or, in severe cases, amputations, a risk that's 15 times higher for seniors with diabetes, per the American Diabetes Association. Early intervention for arthritis can also preserve joint function, making it easier to stay active and independent. What if you're worried about the cost of seeing a doctor? Many insurance plans, including Medicare, cover podiatry visits for seniors, especially if you have a diagnosed condition like diabetes. So check your coverage to ease the financial burden. How can you make doctor visits less stressful? Prepare a list of questions beforehand. Ask about the cause of your pain, treatment options, and any lifestyle changes you can make to improve your foot health. Why does fixing this mistake matter so much? Ignoring foot pain doesn't just affect your feet. It can lead to a domino effect, reducing your activity levels, increasing your fall risk, and even impacting your mental health by making you feel isolated or depressed. By taking action early, you can stop small problems from becoming big ones, ensuring you stay mobile and active for years to come. Let's keep the momentum going. Up next, we'll tackle mistake 3 and continue your journey to pain-free feet. Let's move on to mistake 3, neglecting daily foot hygiene, a simple oversight that can lead to painful and even dangerous issues for seniors. Many of you might skip washing your feet regularly, especially if mobility issues make it hard to reach them, or you might not dry them thoroughly after a shower, thinking it's not a big deal. But did you know that poor foot hygiene can create a breeding ground for bacteria and fungi, leading to infections like athlete's foot, fungal toenails, or even more serious bacterial infections? A Journal of the American Podiatric Medical Association study found that 60% of seniors have experienced foot infections due to inadequate hygiene, which can be particularly risky for those with compromised immune systems or diabetes. Why does this happen? As we age, our skin becomes thinner and more fragile, making it easier for bacteria to enter through small cracks or cuts, especially if your feet are often damp or sweaty. For seniors with diabetes, poor hygiene can increase the risk of diabetic foot infections, which can lead to ulcers or, in severe cases, amputations. A risk that's 25 times higher for those with diabetes, according to the American Diabetes Association. Neglecting hygiene also allows dead skin to build up, leading to painful calluses or corns that can make walking uncomfortable. So, how can seniors fix this mistake and establish a proper foot hygiene routine to keep their feet healthy? First, wash your feet daily with mild soap and warm water, paying special attention to the areas between your toes where moisture can get trapped, as this is a common spot for fungal growth. Second, dry your feet thoroughly after washing. Use a soft towel to pat them dry, ensuring no moisture remains, as dampness can encourage bacteria and fungi to thrive. Third, apply a moisturizer to prevent dry, cracked skin, but avoid putting it between your toes to reduce the risk of fungal infections. A cream with urea or lactic acid can help keep your skin soft and smooth. What if you have mobility issues that make washing your feet difficult? Use a long-handled sponge or ask a caregiver for help to ensure your feet are cleaned properly without straining yourself. How can you prevent infections if you're prone to sweaty feet? Wear breathable socks made of natural fibers like cotton or wool and change them daily, or more often if your feet get sweaty, to keep your feet dry and reduce the risk of fungal growth. What about seniors with diabetes? How can they take extra precautions? Check your feet daily for cuts, blisters, or redness, and see a doctor immediately if you notice any signs of infection, as early treatment can prevent serious complications. Why is maintaining foot hygiene so important for seniors? Good hygiene doesn't just prevent infections, it also reduces discomfort from calluses and corns, making walking easier and more enjoyable, which can help you stay active. A Foot Health Facts survey found that seniors who practice daily foot hygiene report a 20% reduction in foot pain, simply by keeping their feet clean and moisturized. proper hygiene also boosts your confidence, as healthy feet are less likely to develop odors or unsightly conditions like fungal toenails, allowing you to feel better about wearing sandals or going barefoot at home. What if you already have a fungal infection? Can hygiene help? Yes, along with seeing a doctor for antifungal treatment. Maintaining a strict hygiene routine can prevent the infection from spreading or recurring, ensuring your feet heal faster. By making foot hygiene a daily habit, you're taking a simple but powerful step toward protecting your foot health and overall well-being. Let's continue to mistake 4 and keep building your path to pain-free feet. Now let's tackle mistake 4, overexerting tired feet, a mistake that can worsen foot pain and slow your recovery as a senior. It's natural to want to stay active. Maybe you're walking longer distances, standing for hours at a family event, or pushing through a busy day of errands, even when your feet feel tired or sore. But did you know that overexerting your feet without giving them proper rest can lead to increased inflammation, swelling, and even injuries like stress fractures or plantar fasciitis flare-ups? A Foot and Ankle International study found that 55% of seniors experience aggravated foot pain due to overactivity, often because they ignore their body's signals to rest. Why is this so harmful? When your feet are already tired, continuing to strain them puts extra pressure on your muscles, tendons, and joints, which can exacerbate conditions like arthritis or neuropathy, making pain and swelling worse. For seniors, this is especially concerning because aging reduces your body's ability to recover quickly. Overexertion can lead to prolonged inflammation, which can take days or even weeks to subside, limiting your mobility in the meantime. Overexertion can also increase your risk of falls, as tired feet are less stable, making you more likely to trip or lose your balance. So, how can seniors fix this mistake and give their feet the rest they need to heal and stay healthy? First, listen to your body. If your feet feel sore, swollen, or fatigued after activity, take a break and sit down to give them a chance to recover before continuing. Second, elevate your feet for 15 to 20 minutes after a long day. Prop them up on a pillow above heart level to reduce swelling by improving circulation, a technique that can decrease swelling by 10% per a Healthline study. Third, use the rice method when your feet are overworked. Rest, ice, apply a cold pack for 10 minutes to reduce inflammation. Compress with a light bandage to support your feet, and elevate, which can help speed up recovery and ease discomfort. What if you love staying active? How can you avoid overexertion without giving up your favorite activities? Pace yourself. Break up your activities into shorter sessions, such as walking for 10 minutes at a time instead of 30 minutes all at once, and take regular breaks to rest your feet. How can you tell if you're overdoing it? Pay attention to warning signs like throbbing pain, swelling that doesn't go down after a few hours, or a feeling of heaviness in your feet. These are signals that you need to stop and rest immediately. What about seniors with specific conditions? Does overexertion affect them differently? Yes. For those with plantar fasciitis, overexertion can cause micro tears in the plantar fascia, worsening heel pain by 15%, per a Foot and Ankle International study, while for those with neuropathy, it can increase nerve irritation, leading to more burning or tingling sensations. How can you support your feet during activity to prevent overexertion? Wear supportive shoes with good cushioning, as we discussed in Mistake 1, and consider using orthotic inserts to provide extra arch support, which can reduce strain on your feet during movement. Why is avoiding overexertion so important for seniors? Resting your feet not only prevents worsening pain, but also helps maintain your overall mobility, allowing you to stay active without setbacks. A Silver Sneakers survey found that seniors who rest their feet after activity report a 25% improvement in foot comfort, making it easier to enjoy daily tasks without discomfort. Proper rest also reduces your fall risk by keeping your feet strong and stable, ensuring you can move with confidence. What if you've already overexerted your feet? How can you recover quickly? In addition to the RICE method, avoid high-impact activities for a few days and consider gentle stretching to relieve tension, but stop if you feel any pain. By being mindful of your limits, you can protect your feet from unnecessary strain and keep them ready for your next adventure. Let's move on to mistake 5 and continue your journey to healthier, happier feet. Let's dive into mistake 5, not addressing poor circulation, a critical oversight that can worsen foot pain and lead to serious health issues for seniors. Many of you might notice symptoms like cold feet, numbness, or a tingling sensation, especially after sitting for long periods. But you might dismiss these as just a normal part of aging. But did you know that poor circulation can significantly contribute to foot pain by reducing blood flow to your feet, which slows healing, increases swelling, and makes conditions like neuropathy or edema worse? A Journal of Vascular Surgery study found that 50% of seniors over 65 experience reduced circulation in their lower extremities, often leading to chronic foot discomfort and a higher risk of complications. Why does poor circulation happen as we age? Aging naturally narrows blood vessels and reduces their elasticity, while conditions like diabetes, high blood pressure, or a sedentary lifestyle can further impair blood flow, leaving your feet starved for oxygen and nutrients. For seniors with diabetes, poor circulation can be especially dangerous, as it increases the risk of foot ulcers by 20%, according to the American Diabetes Association, since reduced blood flow slows the healing of even minor cuts or sores. Poor circulation also makes your feet more prone to swelling, as fluid builds up in your lower extremities, causing discomfort and making it harder to wear shoes or walk. So, how can seniors fix this mistake and improve circulation to ease foot pain and prevent complications? First, incorporate gentle movement into your daily routine. Simple activities like walking for 10 minutes a day or doing seated ankle rotations can boost blood flow by 15%, per a Healthline study, without overexerting your feet. Second, elevate your feet regularly. As we discussed in mistake 4, prop them up above heart level for 15 minutes, 2 to 3 times a day, to help reduce swelling and encourage blood to flow back toward your heart. Third, add circulation-boosting foods to your diet. Foods like salmon, rich in omega-3 fatty acids, can improve blood vessel health, while citrus fruits, high in vitamin C, help strengthen blood vessel walls, reducing swelling and discomfort. What if you have a sedentary lifestyle? How can you improve circulation without major changes? Try seated leg exercises, such as pointing and flexing your toes for 5 minutes every hour, which can stimulate blood flow even if you're sitting for long periods. How can you tell if poor circulation is affecting your feet? Look for signs like persistent coldness, pale or bluish skin, or slow healing sores. These are red flags that you should address with your doctor, as they may indicate a more serious vascular issue. What about seniors with specific conditions? How does poor circulation impact them? For those with neuropathy, poor circulation can worsen nerve damage, increasing numbness and tingling by 10%, per a diabetes care study, while for those with edema, it can lead to more severe swelling, making walking painful. How can you support circulation if you're at risk for these issues? Wear compression socks during the day. They apply gentle pressure to your legs, helping blood flow back to your heart, and can reduce swelling by 12%, according to a Journal of Vascular Surgery study. Why is addressing poor circulation so important for seniors? Improving blood flow not only reduces foot pain and swelling, but also lowers your risk of serious complications like infections or ulcers, helping you maintain your mobility and independence. A Silver Sneaker survey found that seniors who actively manage their circulation report a 25% improvement in foot comfort, making daily activities like walking or standing much easier. Better circulation also supports overall health, as it ensures your feet get the oxygen and nutrients they need to heal and stay strong. What if you suspect a more serious circulation problem? When should you see a doctor? If you experience symptoms like severe numbness, skin discoloration, or sores that don't heal within 2 weeks, consult a doctor immediately, as these could be signs of peripheral artery disease, which requires medical attention. By taking steps to improve your circulation, you're giving your feet the support they need to stay healthy and pain-free. Let's move on to a bonus tip to wrap up your foot care routine. Now that we've covered the 5 common foot pain mistakes seniors make, let's wrap up with a bonus tip that can help you stay proactive about your foot health. Establishing a daily foot check routine. Many seniors overlook the importance of regularly inspecting their feet, especially if they don't feel immediate pain or discomfort. But catching issues early can make all the difference in preventing serious problems down the road. Why is a daily foot check so important? Small issues like cuts, blisters, or redness can quickly escalate into infections or ulcers, particularly for seniors with conditions like diabetes or poor circulation, where healing is slower and complications are more likely. A Journal of the American Podiatric Medical Association study found that seniors who perform daily foot checks are 30% less likely to develop severe foot complications simply by catching problems early and addressing them promptly. A daily foot check also helps you become more familiar with your feet, so you can notice changes like new swelling, discoloration, or unusual sensations that might signal a deeper issue requiring medical attention. So, how can seniors establish an effective daily foot check routine to keep their feet healthy and pain-free? First, set aside a specific time each day, such as after your morning shower or before bed, to inspect your feet, making it a consistent part of your routine so you don't forget. Second, use a well-lit area and a mirror to help you see all parts of your feet, especially the soles and between your toes, where issues like cracks or fungal infections might hide. If you have mobility issues, ask a caregiver to assist you. Third, look for key warning signs during your check. Check for cuts, blisters, redness, swelling, or any changes in skin color, such as pale or bluish tones, which could indicate circulation problems, and feel for unusual sensations like numbness or tingling, which might suggest neuropathy. What should you do if you notice any of these issues? Don't ignore them. Clean and bandage minor cuts or blisters immediately to prevent infection. And if you see signs of infection like pus, increased redness, or warmth, or if swelling or discoloration persists for more than a day, contact your doctor right away, as these could be early signs of a more serious problem. How can you make your foot check routine more thorough? Keep a small foot care kit handy. Include items like a mirror, antiseptic wipes, bandages, and a moisturizer, so you can address minor issues on the spot and keep your feet clean and hydrated, as we discussed in Mistake 3. What if you have diabetes? How should your foot check routine differ? For seniors with diabetes, be extra vigilant. Check for even the smallest sores or abrasions, as these can quickly turn into ulcers due to slow healing, and avoid using harsh chemicals or cutting calluses yourself, as this can lead to injury. Instead, see a podiatrist for professional care. How can you ensure you don't miss any spots during your check? Use a systematic approach. Start at your toes, move to the tops and sides of your feet, then check the soles and heels, ensuring you cover every area and take your time to be thorough, as rushing might cause you to overlook something important. Why is this daily habit so beneficial for seniors? A daily foot check empowers you to take control of your foot health, helping you catch issues before they become painful or debilitating, which can significantly improve your quality of life. A Foot Health Fact survey found that seniors who perform daily foot checks report a 20% increase in confidence about their foot health, as they feel more proactive and less worried about unexpected problems. This routine also complements the other tips we've discussed, like wearing the right shoes, maintaining hygiene, and improving circulation, creating a comprehensive foot care plan that keeps your feet healthy and strong. What if you're new to foot checks and feel overwhelmed? How can you start small? Begin with a quick 2-minute check each day, focusing on just one area, like your toes, and gradually build up to a full inspection as you get more comfortable with the process. By making a daily foot check a habit, you're investing in your long-term mobility and independence, ensuring you can keep doing the activities you love without foot pain holding you back. Let's head to the outro to wrap up this video with some final thoughts. There you have it, seniors. 5 common foot pain mistakes and how to fix them, plus a bonus tip to keep your feet healthy and pain-free. Let's quickly recap what we've learned today to help you take charge of your foot health. First, we discussed how wearing the wrong shoes can worsen foot pain, and how choosing shoes with a wide toe box, low heels, and good arch support can make a big difference in your comfort and stability. Second, we highlighted the dangers of ignoring early foot pain symptoms, encouraging you to see a doctor promptly to prevent conditions like neuropathy or arthritis from progressing. Third, we explored how neglecting daily foot hygiene can lead to infections, and how a simple routine of washing, drying, and moisturizing your feet can keep them healthy. Fourth, we addressed the risks of overexerting tired feet, showing you how to rest, elevate, and use the RICE method to reduce swelling and prevent injuries. Fifth, we tackled the issue of poor circulation, offering tips like gentle movement, elevation, and a diet rich in omega-3s to improve blood flow and ease discomfort. Finally, our bonus tip gave you a daily foot check routine to catch issues early, empowering you to stay proactive about your foot health. Why does all this matter? By avoiding these mistakes, you're not just reducing foot pain, you're improving your overall quality of life, staying active, and maintaining your independence as you age. Foot health is the foundation of mobility, and small changes can lead to big improvements, whether you're walking to the park, gardening, or playing with your grandkids. We hope these tips inspire you to take better care of your feet. Starting today, your feet deserve it. What did you think of this video? Let us know in the comments below. Share which tip you found most helpful or any foot care challenges you're facing, and we'll do our best to address them in future videos. If you found this video helpful, please give it a thumbs up, share it with a friend or family member who might benefit, and don't forget to subscribe to Senior Health Hub for more practical health tips tailored just for seniors. We've got plenty more advice coming your way to help you live your best, most active life. Until next time, take care of your feet, stay safe, and keep moving forward, one step at a time.